Universal healthcare refers to a healthcare system in which all individuals have access to necessary healthcare services without experiencing financial hardship. This concept emphasizes the need for equitable access to medical care, regardless of income, social status, or geographic location. The significance of universal healthcare within the context of global reform lies in its potential to alleviate disparities in health outcomes and financial strain, promoting a healthier global society. A paramount example is the healthcare system in countries like Norway and Canada. These nations have successfully implemented universal healthcare models, ensuring that all citizens receive comprehensive health services funded predominantly through taxation. As a result, these countries often enjoy higher quality of healthcare services, longer life expectancies, and better overall public health statistics compared to countries without such systems. In contrast, the United States, which does not have universal healthcare, frequently encounters debates over medical affordability and accessibility, illustrating the limitations of non-universal systems. Supporters of universal healthcare argue it is a fundamental human right and a moral obligation. They suggest it leads to a healthier population, boosts economic productivity, and reduces healthcare costs in the long run by focusing on preventive care. Moreover, organizations like the World Health Organization advocate for universal healthcare as essential for sustainable global development. However, the road to implementing universal healthcare is laden with challenges. Critics argue it can lead to increased taxes and government spending, potentially reducing the quality and efficiency of healthcare services due to bureaucratic inefficiencies. Concerns over long wait times for treatment and the potential stifling of medical innovation due to regulated pricing structures also prevail. Countries without robust economic systems or infrastructure may struggle to implement such comprehensive reforms, highlighting the complexity of achieving a truly global solution. Universal healthcare also intersects with other aspects of global health, such as the need for coordinated international policies, financing strategies, and addressing the specific health needs of different populations. Its implementation on a worldwide scale would require unprecedented levels of collaboration and commitment between governments, NGOs, and the private sector. Thus, setting the context of universal healthcare involves acknowledging both its transformative potential and the substantial obstacles to its global adoption. This exploration helps the audience grasp the profound implications that universally accessible healthcare could have on the health, economy, and societal norms worldwide. Understanding universal healthcare is crucial when exploring the idea of having free healthcare worldwide. At its core, universal healthcare refers to a system where all individuals have access to necessary healthcare services without suffering financial hardship. This concept is built on the principle that healthcare is a fundamental human right. Universal healthcare systems vary globally, but generally, they are government-funded through taxation and ensure that healthcare services are available to everyone, regardless of their economic status. This point is significant in relation to our main topic because universal healthcare forms the backbone of the idea of free healthcare worldwide. It represents a transformative step towards achieving health equity, eliminating the disparities that arise from unequal access to medical services. Access to healthcare without financial barriers can lead to healthier populations where people receive timely preventive care, reducing the incidence and severity of diseases. Real-world examples of universal healthcare include the National Health Service, NHS, in the United Kingdom, and Canada's publicly funded system. The NHS provides a range of services funded through taxation and offers them free at the point of use to all UK residents, showcasing a practical application of universal healthcare. Similarly, Canada provides coverage for hospital and physician services through a government-funded program, ensuring that essential medical services are accessible to all citizens without direct charges at the point of care. Proponents of universal healthcare argue that it leads to better health outcomes, reduces overall healthcare costs, and ensures equality in access to health services. They suggest that when people aren't burdened by healthcare costs, they are more likely to seek preventive care, thereby reducing long-term costs and involvement in expensive emergency care. However, the idea of universal healthcare is not without its challenges and controversies. Critics often point to the potential for increased taxes, long waiting times, and the burden on public finances as significant drawbacks. Some believe that such a system could lead to inefficiencies and reduced quality of care if not managed properly. Understanding universal healthcare influences other aspects of the main topic by highlighting both the opportunities and challenges involved in implementing a global reform. It sets the stage for discussions about the intricacies of global cooperation, the restructuring of international health policies, and the socio-political implications of achieving equitable health access on a worldwide scale. By recognizing these factors, we can better appreciate the complexity and potential benefits of striving for a world where healthcare is universally accessible. The economic impact of global healthcare reform represents a crucial aspect of imagining a world with free healthcare. At its core, universal healthcare reform would aim to provide accessible and free medical services to every individual, regardless of their financial status or geographic location, effectively dissolving disparities in healthcare accessibility. Introducing such a transformative system on a global scale carries profound economic implications, both positive and challenging. First, consider the significance of this reform. Universal free healthcare could lead to a healthier global workforce. Economic productivity often reflects the health of a nation's population. Healthier individuals mean fewer sick days, increased worker efficiency, and a more robust global economy. For example, countries like Norway and Canada, which have universal healthcare, enjoy not only better health outcomes, but also significant savings on healthcare costs per capita compared to nations without such systems. One real-world example is the COVID-19 pandemic, which highlighted how interconnected health is with economic well-being. Countries with strong healthcare systems managed better economically by maintaining public health, ensuring that their labor force remained active. This demonstrates the direct correlation between health systems and economic stability. Supporting opinions argue that investments in universal healthcare act as an economic stabilizer. By reducing medical bankruptcy, one of the most common forms of bankruptcy, universal healthcare can enhance consumer spending on goods and services, thereby boosting economic activity. Moreover, universal healthcare can drive innovation in the healthcare sector, leading to cost-effective medical technologies and practices as systems seek to provide care for all efficiently. However, challenges and controversies exist. Critics argue that implementing global free healthcare could impose significant financial burdens on governments, necessitating higher taxes or reallocation of funds from other sectors. There's also concern about inefficiencies and potential declines in care quality due to overburdened systems. Furthermore, this reform ties into global debates about equity and justice, impacting how healthcare systems worldwide prioritize and allocate care. As these systems evolve, they may influence global policies on related issues, such as pharmaceutical pricing and cross-border health initiatives. In sum, the economic impact of global healthcare reform is a multidimensional issue that not only addresses the financial viability of universal healthcare, but also amplifies its social and humanitarian benefits. This reform could reshape global economic landscapes, fostering a more equitable and productive world, though not without overcoming significant challenges and resistance. Imagine a world where healthcare is universally accessible to all, regardless of income, status, or location. This is the premise behind the concept of universal healthcare, where improved public health and well-being are significant outcomes. Universal healthcare means that every individual has equal access to essential medical services, leading to healthier populations and higher overall life satisfaction. The significance of improved public health under such a system cannot be overstated. Universal healthcare reduces the prevalence of untreated diseases and conditions, leading to lower mortality rates and increased life expectancy. With preventive care services more readily available, countries can focus on proactive health measures, reducing the incidence of chronic diseases and lowering long-term healthcare costs. For example, in countries like Canada and the United Kingdom, where universal healthcare is in place, citizens enjoy a higher overall health status. These systems ensure that regular checkups, necessary preventive measures, and timely treatments are accessible to all, resulting in fewer hospitalizations and a more robust healthcare system. Another example is Cuba, which, despite economic challenges, boasts a healthcare system focused on prevention and primary care. This emphasis has led to strong public health outcomes, demonstrating the effectiveness of widespread access to healthcare services. Supporters of universal healthcare argue that such systems promote social equality and economic productivity by ensuring everyone has the opportunity to live healthy lives. They assert that good health is a basic human right and should not be contingent on financial capability. However, the implementation of universal healthcare also comes with challenges and controversies. Critics often point to the potential for increased taxes and government spending, concerns about efficiency, longer wait times, and a possible decline in the quality of care. Additionally, there's the challenge of coordinating a global reform effort, given the diverse economic and political landscapes of different countries. Improved public health and well-being connect deeply with other aspects of universal healthcare, such as economic benefits and social equity. By promoting healthier populations, universal healthcare can lead to a more productive workforce, reduce poverty-related health disparities, and enhance the overall quality of life. Ultimately, while the transition to universal healthcare poses challenges, the potential benefits of improved health and well-being provide a compelling argument for why pursuing this global reform could transform the world for the better.